Okay, so here's a short video on some more sort of finger yoga really. This isn't about the small muscles in the hand, the intrinsics here. This is about trying to get the fingers to flex better. This is about trying to improve what we call composite flexion. So if you look at the way your finger bends, it bends at all of these joints. It bends at the metacarpophalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. We call these the MCP joint, the PIP joint, and the DIP joint. So all your fingers have 3 joints like that. And in my other video on finger yoga, I'm talking about just flexing the interphalangeal joints, both the proximal and the distal ones, and doing this to stretch up the little muscles in the hand like this. But if you bend the MCP joints as well, that doesn't stretch these small muscles in the hand. It relaxes them, in fact. So, and this is a way to find out whether these joints here are a bit tight and whether they are a bit stiff to come into full composite flexion. That just basically means add all 3 together and you get the full range of flexion. And causes for that are stiffness in the joints because the soft tissues around the joints have become a bit tight, or the whole finger is a bit swollen with some edema, some inflammatory juice around the finger, or the flexor tendon is a bit swollen in flexor tendinitis, or somebody's had trigger finger, or if you've had an operation, there's some scarring here on the palm or some scarring on the back of the hand, and the whole thing's generally become tight, or you've had a cast on your hand for a while. And it's important to try to regain your active and passive flexion. So active is when you pull it down using the tendons in your forearm here to pull these nails right down into what I call the palm crease. This is the distal palm crease just across here. And so you should try to improve that. You can actively do it within your own comfort range, and then give a little nudge using your other hand to try to get it in as much as you can. And then you can do a little place and hold test to see if your tendons are able to hold it in. So you can push it in a little bit and then make sure you stay reasonably comfortable. Just maybe do some breathing a bit like you would with yoga. Relax into the stretch, take your time. Don't do that springing motion. Just put constant pressure on there like that. And then when you take these fingers away, you might see that one of your fingers or two or three of your fingers may come out again. And you push them in and see if you can then retain them like that as best you can. A sort of place and hold test like that. And I find that musicians particularly like metrics because they can measure exactly how much they can do. And if you're doing chord shapes on the guitar, you might need lots of finger flexion, or on a violin, for example. And so musicians can tell when they're improving, but a very simple way of working out how you're doing with this is this little card trick that I've got here. So you basically put the card into the palm crease like that, and if your fingers are normal, you should be able to reach very close to the end of that card, like that. If, however, you've got some stiffness in your fingers, you'll find that you can't quite get to the end of the card, and say your middle finger is really stiff, it'll be like that. And so I often give my business card to my patients like that, and at the same time I'll do a little drawing like this, and you can just take your pen, like a child drawing around their hand in infant school. You can just draw on here like this, and mark this up. You get that, and then you just put on here today's date, like that. And then when you go back to it the next day, you work on it again, you do a bit of work on it, stuff that in the palm crease again, you come down here and you redraw that, and then you can see how you are on another day. You can label it accordingly. So that's a very simple way of just tracking your own finger flexion progress. If you're having difficulty getting your nails down to your palm, diabetics have a lot of problem with general stiff hands as well, and although they can't extend their fingers very well, they often struggle with flexion as well, can barely manage what we call palm contact in the first instance, and then slowly manage to get beyond palm contact down into the palm crease, and that's where you want to be. And if you can get your range all the way to the end or very close to it, it won't then hurt when you come close towards the end of the range, because all the structures that are tight will no longer be tight. And so that's a very useful tip.